to contribute to this in order to secure some more tools and these platforms. Now this Zoom workplace, actually we had a 100 user package, and we were when we were doing CPDs for like our public health staff, sometimes we did 400 500. We got it from outside and we had to hire from another service provider. However, we were able to buy this, and now we can give it to for you all of your work, your research work. If you want to empower people to reach out communities, health workers, this is available free of charge now for you, all of you. And so we'll be getting sponsors to get more and more platforms. And these were shortlisted, and not only these, there were about 10 items shortlisted, and these are some of those. And I know you had lots of problems. Those who went overseas, they didn't have an institutional email sometimes. The LK one is not working, and so some universities don't recognize that because these have been misused. And we'll be getting institutional email for the CCPSL, and through this we'll be able to help our trainees a lot when they go overseas, and they will get into lots of networks from that institutional email. So one was that, and like that, so we can give you research qualitative analysis tools, and now these are available with us. And so this, however, we will not be offering this online for you to access through online. It's only by request, and we'll develop the mechanism and let you know in the coming few weeks, and we'll finalize this. It will be definitely password protected, and we urge all of you to use it appropriately. And so we'll be getting in touch with you, and thanks for the President, Council, and all those who have supported this. And this is now in the got started off the ground. And members are encouraged to maximize the use of these tools and respect ethical and institutional guidelines. And so we'll be informing all of you how to be in touch with this, and how to make the maximum use of it. Thank you very much.
Thank you very much, sir. So this summit has not been just a platform for dialogue and discovery, but also a celebration of excellence. It's now the time to recognize the outstanding contributions to research, innovations, and the practices in public health.
So these prestigious awards honor individuals and teams who have demonstrated exceptional dedication and impact in advancing health equity, science, and system strengthening.
We begin with the annual Health Research Award of Excellence, conferred by the College of Community Physicians of Sri Lanka. These accolades are a tribute to pioneers and their legacies.
Ladies and gentlemen, during the course of the summit, a significant number of high-quality abstracts were presented, reflecting the depth and diversity of research and innovation within our public health community. So we recommend all contributors for their dedication and scholarly excellence. So these awards are not only the scientific merit of work present, but also the profound impact such research can have on shaping the future of the public health in Sri Lanka and beyond.
Ladies and gentlemen, in this evening we are proud to present a series of prestige health research awards that recognize outstanding contributions in various domains in public health. These awards not only celebrate the academic excellences, but also honor the endurance legacies of individuals who have shaped the field through their vision, service, and scholarship. The awards to be presented today are as follows. Dr. Ranjan De Silva Award for Epidemiology, College of Community Physicians of Sri Lanka Research Award for Health Promotion, Health System, and Non-Communicable Diseases, Dr. N.W. Vidyasagar Research Award for the Maternal and Child Health, Dr. HMSSD Herath Research Award for Environmental and Occupational Health. Ladies and gentlemen, if there are any family members of the distinguished individuals for whom these awards to be named are present with us in this evening, we would be deeply honored to invite you to the stage during the presentations. Your presence adds a profound sense of legacy and meaning to this moment as we celebrate excellence in their honor.
Ladies and gentlemen, the first award to be presented in the field of epidemiology, a cornerstone of public health that provides the scientific foundation for understanding patterns of disease, identifying risk factors, and guiding evidence-based interventions. It's with great honor we present Dr. Ranjan De Silva Research Award for Epidemiology, which recognizes outstanding research that exemplifies methodological rigor, relevance, and potential for public health impact.
To present this award, may I cordially call upon to the stage family member of the Dr. Ranjan De Silva, Mr. Rajiv De Silva. In the absence of Dr. Ms. Rajiv De Silva, I would like to call upon to the stage Dr. Vindya Kumarapeli to present this award.
And the Dr. Ranjan De Silva Research Award for Epidemiology in Global Public Health Summit 2025 goes to the abstract title, A Cluster Randomized Trial Assessing Long-Lasting Insecticide-Rated Nets for Controlling Phlebotomus argentipus in Sri Lanka. It was authored by Piyasiri SP, Senanayaka SASC, Samaranayaka TN, Ingwin E, Valenzuela JG, Piyasiri NN, Kamahau S, and Karunavira ND. The next award is the College of Community Physicians of Sri Lanka Research Award for Health Promotion, Health Systems and Non-Communicable Diseases. This award recognizes research that address some of the most pressing challenges in public health today, from strengthening our health systems and promoting health behaviors to tackling growing burden of non-communicable diseases. So these areas are critical to achieving sustainable health outcomes and equity, both nationally and globally. To present this award, may I cordially invite the Conference Chair of the Global Public Health Summit 2025, Professor Vajra Disanayaka.
It is with a great pride that now we present the College of Community Physicians of Sri Lanka Research Award for the Health Promotion, Health System and the Non-Communicable Diseases. And this award goes to the abstract titled Unmet Needs of People with Type 2 Diabetes Mellitus in Gampaha District, Sri Lanka by Vidhanapatirana N, Pereira S and Vikram Singh R. Thank you very much, sir. The next Health Research Award is the Dr. N.W. Vidyasagar Research Award for the Maternal and Child Health. This award honors outstanding research in the field that lies very much closer to our hearts. Maternal and child health is not only the marker for the national development, but also reflection of how compassion, care, and the science comes together to protect the most vulnerable in our society. Advancing this area means investing in healthier generations to come. And to award this present, may I cordially invite onto the stage a family member of Dr. N.W. Vidyasagara, if present.
We are privileged to present Dr. N.W. Vidyasagara Research Award for Maternal and Child Health in recognition of excellence and meaningful contribution in the essential domain. And this award goes to the abstract title, Assessment of Family Functioning and its Associated Factors Among Grade 10 Students in Government Schools in Kegal District, Sri Lanka, by Jaratna K.A.D.N.S. and Withana P.V.S.C.
Thank you very much, sir, and congratulations. The final health research award to be presented this evening is a Dr. HMSSD Herath Research Award for Environmental and Occupational Health. This award recognizes excellence research in two critical and interconnected domains: the environmental we live in and we work in, and also from safeguarding air and water quality to ensuring the safe and healthy workplace. Research and environmental and occupational health plays a vital role of protecting population health and preventing disease at its source. To present this award, may I kindly request the daughter of the Dr. HMSSD Herath, Dr. Deepika Herath. We are honored to present the Dr. HMSSD Herath Research Award to the collaborative contribution that advance knowledge and solutions in their essential areas. And this award goes to the abstract titled Work-Related Musculoskeletal Pain Among Female Tea Plantation Workers in Nuwara Eliya, Sri Lanka, a mixed method study by Dr. T. Gobilan.
Thank you, madam. And ladies and gentlemen, we now move to honor visual scholarships through the Poster Presentation Awards, a celebration of creativity and clarity that has brought clinical public health topics to life in a vivid and impactful ways.
The award for the best posters will be presented to the top 3 ranked entities. At this time, I may warmly invite the Secretary of the CCPSL, Dr. Ruan Ferdinand. These awards recognize excellent talent in visual storytelling in public health communication, celebrating those who have efficiently transformed complex data and ideas into the compelling and accessible visual narratives.
We begin with the second runners-up award, which is presented to the poster that demonstrated outstanding creativity, clarity, and impact among many excellent entries. So this award goes to the poster titled Knowledge and Practices of Management of Fever in Children and its Associated Factors Among Primary Caregivers in Selected Medical Officer of Health Areas in Colombo, Sri Lanka. And the authors are Anwar Ali TA, Hinojan T, Karin DW, HWD, Tilakaratna HEDCS, Dharmasoma UWNK, and De Silva Valley. Thank you. Next, may I cordially call upon the stage Dr. Tushani Gabrera, the Scientific Co-Chair of the Global Public Health Summit 2025. The first runner-up award honors for the poster that not only impressed the judges with its innovative approach, but also its ability to engage and educate the audience. This award goes to the poster titled Comparison of the district-wide nutritional status with socio-economic indices in Sri Lanka 2019 to 2022 by Jaipodi H, De Silva C, and De Silva H.
Very much. And now the moment we all have been waiting for, the award for the best poster of GPHS 2025. For this, may cordially invite the scientific co-chair of the GPHS 2025, Professor Upul Senara. This highlights accolade the recognition of truly excellent work that exemplifies excellence in research communication, visual design, and public health relevance. The award for the best poster of the Global Public Health Summit 2025 goes to the poster titled Self-Esteem and its association with the social demographic factors and quality of life among institutionalized older adults in the Colombo district, Sri Lanka. This is by Darshini UGN Irangakol IMPS Varnakula Surya SSP and Gunawardhana LSG.
Thank you, sir. We now shine a spotlight on an initiative that exemplifies innovation in disease management. The Dr. H.S.R. Pereira Award for Health System Strengthening Research for Public Health Enhancement in Sri Lanka in Global Public Health Summit 2025 is awarded to Dr. K.A. Lahiru C. Koditwaku, who has been unanimously selected following an initial round of screening of submitted abstracts and presentations held.
Dr. Koditwaku's work, Road Towards the Regional Center of Excellence in Dengue Management, the story of the Center of the Research and Training at the National Institute of Infectious Diseases, emphasized the strengthening of the front line of the health workers to maintain the Sri Lanka's low dengue case fatality rate. His team has developed a practical training program and established the center, which has supported regional capacity by building in other countries like Bangladesh, Myanmar, and Bhutan as well. Please welcome Dr. Lahiru Koditwaku, who will be share the journey of the center research and training at the National Institute of Infectious Diseases and the transformation into the Regional Center of Excellence for Dengue Management. The floor is yours, Dr. Lahiru Koditwaku.
Thank you, sir. Distinguished guests, colleagues, ladies and gentlemen. At the onset, let me thank the College of Community Physicians and also the Public Health Fraternity for allowing us to present our case today. With pride and humility, I would like to present our case, Road Towards a Regional Center of Excellence in Dengue Management, the story of Center for Research and Training, National Institute of Infectious Diseases. As you might know, health workforce is a strong health system building block. Ability of a country to meet its goals depend on the knowledge, expertise, skills, and motivation of the health workforce. Countries with resource constraints like us, this matters most. And with diseases like dengue, with epidemic potential, where shocks and stresses can always rattle the health system, this capacity of health workforce is of utmost importance. So, why South Asia and why Sri Lanka? So, more than half of the global dengue burden is in Asian region, South Asian region. As we all know, Sri Lanka is also endemic to dengue. However, over the years, Sri Lanka has achieved and also sustained a low case fatality rate in dengue compared to other regional countries. So one of the reasons for this success is the capacity of our frontline healthcare workers in dengue management, clinical management, and also in dengue prevention. So, can we envision Sri Lanka as a regional powerhouse in dengue management? So, Sri Lanka has a long history of capacity building efforts of frontline healthcare workers, both in clinical management and also in public health setups. Curative expertise backed by an extensive public health experience over decades. Propagating our expertise and experience in dengue management to the region, beyond our region even, through a tailored capacity building effort was our initial concept for building this particular program. But was there any such need in the regional setup? So we have to sort of have some evidence to prove that there is evidence for such training capacity. So we have done a comprehensive desk review of regional training needs in dengue management prior to conceptualizing this program. We have also reviewed a WHO expert mission from Sri Lanka to Bangladesh in 2023, where Bangladesh had their worst dengue epidemic. We also went through some in-depth interviews of the subject specialists who took part in this particular mission to Bangladesh, just to understand the capacities of these countries in dengue clinical management as well as in public health aspects of dengue management. So we also looked through the evidence and recommendations from the Integrated Vector-Borne Disease Review of Sri Lanka by WHO in 2024, which highlighted some of our capacities in preventive aspects of dengue management. And also we had a feedback from local dengue management trainings which have been conducted in National Institute of Infectious Diseases. Thus far they have trained last year and this year alone more than 500 medical doctors and nurses from Sri Lanka. So their feedback matters. So what we have found out through this evidence generation, there was a need for a comprehensive and a structured training in dengue management encompassing both clinical and also public health components. In most of the training programs, the public health component was missing. And also there was a lack of a particular regional platform to share best practices among countries. Say like Bangladesh have their own best practices, Sri Lanka has their own best practices, but there was a lacking in a regional platform to share these best practices, including clinical management, epidemic and vector surveillance, and also particularly outbreak preparedness and response in dengue. And also the trainings which were happening around the region was happening in a very siloed way. Doctors and nurses were being trained as different sectors, not as a team. This team building is essential when you manage dengue, both in the public health sphere as well as in the clinical sphere. So, what we envisioned was a training program, a comprehensive training program, which captures both public health and also the clinical aspects of dengue management. So we created a comprehensive training curriculum, and we identified a pool of experts ranging from internal medicine, medical imaging, immunology, epidemiology, emergency management, vector control, and also nursing, because nursing is also an important part of dengue management. Curriculum was pilot tested in a group of medical and emergency medicine registrars who underwent training in the NIID. And then we approached the WHO. We identified NIID, given its expertise over the years in dengue clinical management as a training center. And also we identified National Dengue Control Unit, given its vast experience in dengue prevention at the field level as a training institute. And also we identified Sri Lanka Medical Association as a coordination and logistics body, given their experience in collaborating with international partners over the years So all these three institutions combined together, we had a regional training platform. Initial funding support and training curation was requested through WHO Sri Lanka and also WHO Sierra office. Existing facilities at the NIID, National Institute of Infectious Diseases, were modified with suitable digital infrastructure and support systems to conduct a local training. NID auditorium and also classrooms were converted to fully fledged training facility, and we rebranded this facility as the Center for Research and Training, or CERT. So the inaugural training for these regional colleagues was conducted for a group of 15 doctors and nurses from Bangladesh, followed by 15 doctors and nurses from Bhutan and Myanmar. The training was extensive 7-day training which encompasses components of with ward classes, multidisciplinary sessions, hands-on clinical, imaging, laboratory sessions, public health field visits where they have an extensive public health component, visiting MOH offices, visiting vector control areas. Then also we had an outbreak simulation exercise where they learned how public health and clinical sectors in Sri Lanka acted together to prevent the outbreak. Intersectoral coordination and collaboration skills development sessions were also held. These were some of the pictures of hands-on clinical training at the Center for Research and Training at NIID. And these were the public health training at MOH settings, where they went through vector control, vector surveillance aspects, and also the setup at the Medical Office of Health Office, and some of the field visits to dengue high-risk sites, such as construction sites. So they had the full spectrum of dengue management which Sri Lanka has to offer. So we didn't stop there following their training. We want to sustain the learnings. We want to sustain the evidence that was generated through this learning. So follow-up sessions with the trainees once they return to their countries were held to discuss local adaptations of these training methods, to discuss some of the difficult cases that they find in wards and also in the public health setup, challenges and practical solutions that they have envisioned in their field level. And we made a community of practice where we meet every 2 months to discuss all these aspects with the local expert group. So, what was the success? What was the success for us, and also what was the success for these countries who participated in the training? So, trainees from Bangladesh, they contributed as expert resource personnel for the development of dengue management guidelines of Bangladesh 2025 with the technical inputs from our own local resource team. Ministry of Health Bangladesh adopted Sri Lanka's low cost and also effective bedside PCV monitoring and ultrasound scanning by procuring bedside PCV machines and also ultrasound scanners for the tertiary care hospitals with the support of technical expertise from Sri Lanka. Bhutan trainees conducted their first TOT program for dengue management, encompassing both clinical and also the public health aspects, because in their trainings, the public health aspect was missing. So they had their first training of trainer exercise following our training. And we now have pending requests for training from Maldives, Nepal, and also some of the Mediterranean countries, which now the dengue is sort of shifting towards the Mediterranean area, and also from Americas. We have some requests to conduct this particular training. These are the evidence of success. You can see some of the Bangladeshi websites also in the black reporting Bangladesh to adopt Sri Lanka's model for dengue elimination, and also some of the reports in the WHO CRO website about the training. So, in the Trump era, how we are going to navigate this training, how we are going to sustain this training, that was the question which comes to many of us. So we had a very practical solution, training curation to 2 pathways through WHO regional office and also funded by WHO, and also open call for trainees through self-funded pathways. Most of the European countries and most of the Americas, they are willing to sort of pay and come to Sri Lanka to get this training during their holidays. We already have some requests. And also the routine maintenance of the Center for Research and Training was given to NIIT through funds generated by these trainings perhaps. Trainees from Bangladesh, Bhutan and Myanmar, we requested them to contribute as the master trainers for the next program. So they willingly agreed. So with our local experts, they will be participating in the next proposed programs for Maldives and Nepal and one batch of Myanmar colleagues as well. We also do continue these local team trainings for our postgraduate trainees and doctors from the government sector as well as from the private sector, in between the trainings that we have for our international colleagues. This was not done in a single day. These were the phases of vision, dedication and innovation. Some of them are present here today. I must acknowledge their presence also. For some gentlemen, Dr. Anand Vijayvikram and Dr. Sudat Samaraveera, they have dedicated their entire clinical and public health careers to reach this movement, to propagate our expertise in dengue clinical management and dengue public health management to other countries so that we can champion the cause of Sri Lanka's efforts in dengue management. So we are in debt to these gentlemen who participated as resource persons and also for conceptualization, for coordination. You can imagine managing foreign delegates from their lodging, food to training, everything. So these are the teams that were involved in this particular training. So what is there for us? Position in Sri Lanka as a regional and a global lead in capacity building of health workforce for dengue management, encompassing both public health and clinical aspects. Global south to south collaboration, because we have been going to Southeast Asia for dengue trainings, both clinical and public health, but we can look inwards and we can see that we have the capacity to propagate our own knowledge for our people and also for our colleagues in the global south. Model for forex generation perhaps, because we are getting some international currency through these programs as well, and enhancing our own capacities of next generations of clinical and public health experts in dengue. So ladies and gentlemen, in my short career as a public health expert, public health professional, I have been fortunate enough to grace in some of the UN agencies and also international humanitarian organizations apart from the Ministry of Health. In all these organizations, I have seen Sri Lankan oil running international engines. But now it's time for us to run our own engines through our own oil. We have our own resources that are capable of propagating our knowledge, not only among our colleagues, but also in a South Asian, perhaps even beyond our region as well. So with that, I thank everyone who are involved in this particular training and also establishing this particular center, which will further propagate our expertise in dengue public health management and dengue clinical management to the world. Thank you very much.
Thank you very much, Dr. Lahira Kuritaku. While humbly requesting you to please remain on stage. Thank you very much for that very inspiring presentation. So now, I cordially invite Dr. Susi Pereira to award the Dr. H.S.R. Pereira Award for Health System Strengthening Research for Public Health Enhancement in Sri Lanka in the Global Public Health Summit 2025 to Dr. K.A. Lahiru C. Kuritaku.